So you just started Ozempic or another GLP-1 medication, maybe Wegovy or Mounjaro, and things are going pretty well actually. You're not as hungry, you're eating less, you're feeling hopeful, and then the nausea hits. Maybe it's just a little queasy feeling, or maybe it's a full on, I can't even look at food right now situation. Either way, it is not fun. And you're thinking, is this normal? Is something wrong? Should I stop taking the medication? I hear this from my patients all the time. So, today, let's talk about nausea and stomach upset on GLP-1 medications. Why does this happen? What does science actually say? How many people get it? What makes it worse? And most importantly, what you can actually do about it. Hi, I'm Dr. Bazgha Khalid, and I'm a board certified internal medicine and obesity medicine specialist. And I prescribe GLP-1 medications all the time in my clinical practice. And if you are dealing with nausea on your GLP-1 medication, this video is for you. Okay, so when I talk about nausea on Ozempic or any other GLP-1 medication, I am not talking about just one level of symptoms. There are different symptoms. Some people feel mildly nauseous, like a little unsettled feeling, almost like when you eat too fast. Some people feel genuinely sick, cannot eat sick, cannot look at certain foods sick. Some people throw up, especially in the first few weeks, and some people get stomach cramps, bloating, constipation, or even diarrhea. Now, all of these are in the same family of GI side effects. GI just means gastrointestinal because your stomach, basically your stomach and your gut. And here's the important thing I want you to know right now. If you are experiencing any of these side effects on GLP-1 medication, you are not alone. And this is not because something went wrong. These GI side effects actually make complete sense when you understand how GLP-1 medications work. And that's exactly what I am getting into next. GLP-1 stands for glucagon like peptide 1. That's a mouthful. So let's just call it what it really is. This is a hormone. Your body already makes it naturally. After you eat, your gut releases GLP-1 into your bloodstream. And it does a few things. GLP-1 tells your pancreas, hey, make some insulin. There's food there. It tells your liver, slow down on the sugar. It tells your stomach, hey, slow down. Don't empty so fast. And GLP-1 tells your brain, we are full, stop eating. That's the natural version of GLP-1 that our body makes. Now, Ozempic, Wegovy, Mounjaro, or Zepbound, these are the medications that mimic that natural GLP-1 hormone. But they do so in a much stronger, much longer lasting way that our body would on its own. So remember how I said GLP-1 tells your stomach to slow down? Imagine your stomach is normally like a fast highway. Food comes in, moves through. These medications basically put a traffic jam on that highway. Food sits in your stomach longer than it normally would. That process is called gastric emptying. And when gastric emptying slows down a lot, your stomach gets backed up. Food just sits there. And that makes you feel nauseous. Plus, the GLP-1 medications work on your brain too. There's an area on your brain called the area postrema. Some people call it the vomiting center. Charming name, right? GLP-1 activates receptors in that area, and when it does, it can trigger that nausea signal directly. So you're getting hit from two directions: slow stomach plus nausea signal in the brain. That's why nausea can feel pretty intense, especially at first. Now, let's talk about how common these side effects actually are. In the big clinical trials for semaglutide, that's the medication in Ozempic and Wegovy, the step trials, these are the huge studies. Thousands of people, nausea was the number one reported side effect. About 44% of people on semaglutide reported nausea. Compare that to about 16% of people on placebo. So it's definitely the medication causing it, not just coincidence. Vomiting was about 25% of people reported that, especially on higher doses. Diarrhea about 30%. Constipation about 24%. I have a video about constipation if you would like to know more about this topic. So these numbers for side effects sound scary, I know, but here's the really important part. For most people, these symptoms are mild to moderate, and for most people, they get better within the first 4 to 8 weeks. In the studies, the nausea was almost always described as transient. Transient means it passes. Your body is adjusting to the medication. It is not used to having this level of GLP-1 around all the time. But over time, it adapts. Now, only about 4 to 7% of people stopped the medication during these trials because of the GI side effects, which means the vast majority of people pushed through it. And I'm going to help you to be that majority. But first, let's talk about the things that make nausea on GLP-1 medications worse. Because some of these might surprise you. Mistake number one is eating too much, too fast. Your stomach is now emptying more slowly. So if you eat a big meal the way you used to, it's just going to sit there and make you feel awful. Even if the food is healthy, even if it's a normal portion by old standards, your new stomach capacity is smaller. You have got to eat like it. Mistake number two is eating fatty or greasy foods. Fatty foods are already the slowest thing to leave your stomach normally. Now add a medication that also slows gastric emptying. That cheeseburger is going to sit in your stomach like a rock for hours. Stick to lighter, lower fat food, especially in the first few weeks. Mistake number three is laying down right after eating. Gravity is your friend here. Try to stay upright for at least an hour after eating. This sounds simple, but it makes a real difference. Mistake number four is drinking a lot of liquid with your meals. If your stomach is already full of food that's not moving fast, adding a ton of fluid on top of that is just going to make it worse. Drink your water between the meals, not during. Mistake number five is injecting at the wrong time. Some people find injecting in the morning means they feel sick all day. Others do better at night, so they sleep through the worst part of it. Try different times and see what works for your body. And mistake number six, this one is really common, going up on the GLP-1 medication dose too fast. These medications have a slow dose escalation for a reason. If your nausea is really bad, it's okay to stay at a lower dose for an extra month. Talk to your doctor. There is no rush. A slower climb means way less nausea. Okay, so now you know what makes nausea worse on GLP-1 medication. Let's get to the good stuff, the practical solutions, the things that actually help. Number one, eat small, eat slow. Think of your meals like snacks now. Smaller portions, chew your food properly. Your body does not need as much food as it used to. Give it what it can handle, not what you used to eat. Number two, ginger. Seriously, ginger has been used for nausea for thousands of years, and it actually works. Ginger tea, ginger chews, even ginger ale. Though the sugar isn't ideal, ginger won't completely stop the nausea, but it takes the edge off. Number three, anti-nausea medications if you need them. This is a real conversation to have with your doctor. There are medications like ondansetron. You might know it as Zofran. This is a reasonable tool to use in first few weeks while your body is getting used to the GLP-1 medications. Number four, stay hydrated but do it smartly. Nausea can make you not want to drink, but dehydration makes your nausea worse. Sip small amounts of water or clear fluids throughout the day. Between meals, not during. Small sips. Room temperature water often feels better than cold. Number five, bland foods are your best friend. Think about what people eat when they have the stomach flu. Soups, broths, chicken. These are low fat, easy on the stomach, not glamorous, but they get you through the adjustment period for a few weeks on GLP-1 medications. Number six, give it time. I know that's not what you want to hear when you feel sick, but I want you to know week one is usually the hardest. Week two is often a little better. By week 4 or 5, most people feel dramatically better. Your body is learning a new normal. Give it a chance to get there. Quick check-in with you. Is any of this sounding familiar to you? Any of these mistakes hitting close to home? Let me know in the comments. Let me take a step back for a second because sometimes when patients come to me with nausea on these GLP-1 medications, they feel like their body is rejecting the treatment. Like maybe it's a sign they shouldn't be on it, and I want to gently push back on that. The nausea is not your body saying this is wrong. It's your body saying, wow, this is different. I need a minute. I need to get used to this medicine. GLP-1 medications are genuinely helping people lose significant amounts of weight, reducing blood pressure, improving blood sugar, even lowering the risk for heart attack and stroke. The clinical evidence is remarkable. And for most people, the nausea is a short term bump on the road to long term results. The goal is to manage it well enough to get through the first few weeks. Because for the vast majority of people, the other sides of those few weeks is worth it. Now, if your nausea is severe, if you can't keep fluids down, if you're losing weight too fast, please talk to your doctor. Serious side effects are rare, but they do happen, and you deserve support through this, not just to tough it out alone. All right, let me bring it all together. Nausea on Ozempic and GLP-1 medications is real. It's common and it makes complete physiological sense. Your stomach is slowing down, your brain's nausea center is being activated. Studies show up to 44% of people experience nausea on GLP-1 medications. But for most people, it improves significantly within 4 to 8 weeks. Eat smaller meals, go slow, avoid greasy foods, try ginger, consider anti-nausea medications if you need them. Give your body time, you've got this. Now, I have a question for you. Have you experienced nausea on your GLP-1 medication? And if so, what actually helped you? Leave a comment below, not just for me, but for everyone else watching this who needs to know they are not alone. Your experience might be exactly what someone else needs to hear today. And if this video helped you, please hit that like button. It tells YouTube to show this to more people who need it. And subscribe if you haven't already for more evidence-based metabolic health and weight loss education. Stay happy, stay healthy and well. Bye for now.